One of the main things I worked on at my time at Ujamma Place, and this is on right in front of you at all of your tables, is Ujamma Place's theory of transformation. And what Ujamma Place really does is in that top red box, right? They're trying to move men through the process. They're trying to move create the process and provide the space for men to achieve stable housing, increase educational attainment, secure and retain a job, connect to their family and children, and eliminate the contact with the penal system. We're going to go a little bit deeper into this later on, but for now, what I'm going to do is just sort of frame what is the experience we're going to walk through today. The experience starts before the men come to Ujamma Place. Next is the men begin to enter Ujamma Place. This is a critical point of entry, and I'm going to talk about how we revised or rethought the entry process. And then during is when the act of transformation is happening. And I'll be highlighting the theory of transformation and how we actually created it. And then last is now and into the future will be our last step as we move through this experience together. Is what does this mean? Where are we now? Where are we headed in the future? And we're going to re-engage you guys back at that point as well. So in entering and during, as I'm going to take the stage a little bit here and really dig deep into my own work with Ujamma Place. So entering, right? So first, often what happens is you walk through the door at an agency, you see papers, papers, and papers coming and coming and coming. Okay, so fill out this paperwork, check this box, do this, here's this clipboard, and then you sit down and there's another clipboard. And we began to talk about what does that actually mean for the experience where if you're trying to come in and you're trying to be in a space where you are trying to get help or find assistance or really work on yourself, is why should we be buried in paperwork first? When I began to ask people around it, these are the words that often came up, right? Bureaucratic, cold, buried in paperwork, impersonal, a bunch of numbers, disengaging. So what we said is that we have to think about what is the road already traveled before they got there. And if we sort of said is that the bureaucracy of things is like saying, well, the winding road is the next 99 miles, right? There's already been a long road traveled, so why give someone the preface that, it's going to be another long process just to get through the door, just to talk about your experience, to figure out what you want. So that was sort of what, when we're thinking about it, that's sort of the analogy we give. Instead, we want to say, you see this clear road, right? You come into Ujamma, we're not going to bury you in paperwork. And there's going to be a long, long road ahead of you that we still need to think about, that we still need to do, but there's clarity because you can see the end of that path. So I'm going to talk about how do we actually get to that place. So from intake process to entry process, right? So Ujamma Place started off with 21 different forms, much like many other service providers. Fill out this, check this box. We had a pre-entry form, challenge and success form, which was about 8 pages. Release forms, health forms, policy forms, and we consolidated it down into 4. So there's 3 things you'll see right here, which is the participant guide, the pre-entry form, and the health history form. And then within the participant guide is another thing about policies. It's a single thing, a check-off, sign-off form. So it'll go through all the different policies, kind of like a guide. So I'd like to say that was, that this is the innovation, but it's really not. Right? What you'll notice here when you dig into it is that the challenges to success form, and I'm sure many of the guys remember this, many of the participants, was that super long packet. You'd fill out everything about criminal history, housing, mental health. So it was really, really, really invasive information. Right? It's needed information, but it was invasive information. And this is just sort of standard across the social services. So what we did is that we changed the language, right? We said entry because we're entering an experience, right? We moved from intake, well, what are you taking, right? That was the question we asked, intake. Well, what are you really taking, right? You're taking this information, but what are you doing with it? It's not about my experience, it's about you getting this information. We also sort of came up with a couple different values, which is relationship first, bureaucracy second, and making it about a conversation between 2 people. It's about sharing personal experiences, not marking a checkbox. Breaking down the client-expert binary is, I'm here to serve you, and this is what it is. It's about having people come and talk to each other. And the way we did this was through a methodology called life history storytelling. So it's by Atkinson and Williams, were the people who really developed the methodology for this. We took it from anthropology, but we adapted it so that it would become an intake model. So if we go back and think about what is the mental health, when we're talking about mental health, or what is your connection to your family and your children, is that Kadar, who will typically go through the entry process, and we'll hear from him in just a little bit, will say, tell me your story. You know, who's your crew? You know, who's your family? Tell me about the things going on in your life, and begin to narrow down on those indicators that we were really trying to aim for, which are, you know, the things in that theory of transformation on the top level. So some preliminary results I ran from out of the database was this, is that when we think about it, let's think about retention, right? If you're able to talk about, tell your story and do it in a non-invasive manner and have a discussion with somebody, it's a significantly different process than putting some papers in front of somebody, checking things off off a clipboard. So the common intake was, the previous intake was, coach must read the challenge of success form, figure out how to best meet the needs, and sort of really go into interpreting that experience based just off a few boxes, off a few narratives that the man wrote down. It limited the relationship with the coach, and though if you look at the retention rate after the first visit, only 2 out of 3 would come back again. With the life history storytelling, and I should say we're in our pilot phase of this right now, just about 3 months in, is that we've improved the coach understanding of participant needs and their ambitions, right? Because we're here talking about the narrative, understanding what they were like before they came to the door, similar to the conversations that you had at your tables. It's about unearthing that narrative and not just sort of sitting back and assuming that you can try to get everything within a checkbox or some sort of narrative that was just written down. Is yes, it's expedient. Yes, it helps you understand the baseline information, but in terms of getting the understanding and building a relationship, it's very tough. And I think the thing that was most telling, at least in the preliminary stages, and we still have to prove this concept here through a few more entry processes. The retention rate after the first visit is 90%. So 9 out of 10 guys are coming back because this process, we're saying in part the process has something to do with that. Not exhaustively, but something. So I posed the question, but new area research, why are you messing around with an entry process, right? What does that really have to do with it? It's really about, we are collecting information at entry is one of the most important pieces of the research process. We always want to try to get a baseline. Where are men starting at, right? This is just a different way of understanding where are men starting at, opposed to let's come up with some rigid forms that will, get at it partially. We still have actually the database has very much the rigid forms, but it's a different way of getting that same information. We're also saying is if we increase participant retention, it translates into more information we collected to build a stronger case for the model, which we'll talk about next. So during, this is really the active transformation, the theory of transformation that is in front of you, is what you'll notice here. So for those who are familiar with logic models, that's sort of what describes the ways in which program activities, which is that middle section there, the program elements, begin to produce some sort of outcome. So how does climbing the educational ladder produce increased educational attainment? So you see here, things are stacked up on each other. Often we'll see it is that a logic model will have sort of linears. You'll have your inputs, your activities, your outputs, and then sort of your outcomes, so moving from left to right. Well, as we worked more and more, we figured this path is not linear when we're working with the men. It's not linear at all. Instead, we're going back to the model. It's actually an interaction of different variables here. So we're saying is that at the top we have our ultimate outcomes. We're saying is that the outcomes produce other outcomes, right? There's an interaction between stable housing, or there's an interaction between, increased educational attainment and housing, right? If you have a more greater education, you're more likely to get a job, and you're more likely to achieve stable housing. So we went through, we have about a 40-page evaluation plan that goes behind this and really describes the relationships between all the different outcomes. The other piece of it is that in the program elements, as we're saying, is there's direct and indirect relationships between climbing the educational ladder and all the different outcomes. Often we'll see is that we'll say that only employment skills training will lead to secure and retaining a job. We're saying that's not the case. We're saying is that we went through the literature again and say, what is the effect of it in terms of a causal relationship, a non-causal relationship, and has no influence for it. I think the bottom level there is the foundational elements. So that's empowerment and spirituality, African American culture, high context coaching, and community of men. So these are the things that Ujamma Place is really saying. These are our sort of our foundational elements, are things that are integrated through all of our activities. What I want to talk about is sort of the participatory process for developing the outcomes. Is the outcomes were developed from multiple perspectives. So we have a funder's perspective, a staff perspective, board's perspective, and participants' perspective. So that's that top layer there. So the funder's perspective is I talked to a number of funders and said, well, what are you willing to invest in, right? If these are the different things around stable housing, educational attainment, securing or retaining a job, connecting with family and children, eliminate contact with the penal system. So what you see there are double-starred outcome measures, which are the return on investment measures. So for stable housing situation, it's housed, not homeless, right? We can put a return on investment measure to that, and Jose Diaz is the person who is really helping us put that together. So all the different return on investment measures are indicated in the actual theory of transformation. The other piece that I want to highlight is participants. I interviewed every single participant in the program, as well as did about a 2-hour discussion. I'm sure some of you remember, we had a 2-hour discussion at Ujamma Place around what does success look like within these different categories. When we're thinking about the participants in this, is that we have to move beyond just saying, are we in 120% poverty or not? Instead of ask ourselves, what is the experience of 120% poverty? And if you were to get out of 120% poverty, what would that look like? And that was sort of the framing for each of the different indicators is, what does stable housing mean to you? What does increased educational attainment mean to you? What does it mean to secure and retain a job? What does it mean for you to connect to your family and children? And what does it mean to eliminate contact with the penal system? There were overlaps, of course, across these different perspectives, but there were some unique perspectives that came out of the participants themselves. The other thing I want to highlight is the foundational elements. So that's the bottom piece on the green, on the theory of transformation is we often don't include contextual factors in our logic models. Sometimes we say, context or something like that. Occasionally we do include other factors, and I think we're moving more towards that. But for Ujamma Place, we lifted up through many conversations is that the four foundational elements: empowerment and spirituality, African American culture, and high context coaching. And community of men. And we're saying is that they're integrated into every single one of those program elements above. Empowerment and spirituality, African American culture, high context coaching, community of men are all in climbing the educational ladder, all in building the employment skills, all in volunteering in the community. Ujamma Place will say is that we have all of these, there's lots of people offering these programs. What makes us distinct and what makes us different are these foundational elements. And it's the foundational elements that are, when Savetti was talking about sort of it's something on the inside, it's something that's about me trying to build myself, it's about this self-efficacy piece. It's about being able to build up oneself. That Ujamma Place is arguing is in those foundational elements. They're saying anybody does all these other things too, but this is really what's going to build up these men. This is what the men have identified will also, build up ourselves. So how do you actually evaluate the contextual factors? That's going to be the, I'm going to say that right now, establishing April through July 2013. We're not quite there yet, but there's in implementation sciences, we focus on evaluating contextual factors a lot. And you would go and create a matrix. So for example, climbing educational ladder would be, what does African American culture look like in these different things? And that's what we're going to be working on next as we begin to move forward through this. So a few lessons learned for myself in this is context matters. Is that we know that empowerment and spirituality, African American culture, high context coaching, and community of men are things that will build up these men. And what they've identified will build up themselves, as we've had through a number of conversations. Another thing is what it takes to be a high touch and participatory approach is having lots of conversations about these things. And then the last one is having multiple perspectives and developing outcomes.